Hello, and welcome to another episode of BioNexus Health podcast series. Today, we will be discussing PANDAS, Lyme disease, co-infections, CIRS, biotoxin illness in a preteen. We have with us his parents, Cyndi and Kerry from New Mexico, discussing their son's journey with numerous symptoms, all the way from motor tics to extreme pain, and how he recovered. He's almost fully recovered little by little on a completely plant-based herbal protocol.
Welcome to the BioNexus Health Podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie Dashore.
Thank you so much for joining us today. I appreciate it.
Thank you.
Pleasure.
We're excited.
Good. I love seeing these big, beautiful smiles on your faces because I remember the stress of the first appointment, which was coming through when we first started, right, our journey with Caden. So what made you decide to explore the herbal route? If you can give us a little background on your son, and also, what made you choose to go down the natural path versus pharmaceutical drugs?
As you mentioned earlier, we had a journey and we started off with Western traditional medicine, and it appeared as if our son was getting better a little bit at a time. And then we would see progress, and then we would see digression. And I think our concern as parents was they were addressing the symptoms and not necessarily what we felt were root causes of his issues. Like, we knew he had Lyme's disease. We knew he potentially may have had seizures. He was born premature. There were simple things that we had a clear understanding about. And as parents, we went to medical professionals and we shared those concerns. And it almost felt like we weren't being heard, and a one-size-fit-all was the plan. Like, we've done this for kids in the past. This is what we need to do. So we would do that and see some progress and then digression. And then so when we would come back as parents, we would express our concerns again. And we're like, but there's something deeper than just what's on the surface. And then it was like, we're going to try this. And it was basically antibiotics. I mean, I felt like we antibioticed our poor child to the extreme of where he has an immune to it now. And then we discussed as partners what we needed to do. And I will let Kerry talk about what he saw in our journey when we were working with Western medicine, and then how we transitioned to using herbals and using you as our ally, partner, and resource for the betterment of our child.
Exactly. As Cyndi mentioned, when you take a look at your child and see what's going on, and we'd have all these different meetings, everything was looked at as an island. We've got this symptom here, that symptom there. And we always look at each other and say, there's got to be more of a root problem. No one puts all the pieces together to find out what really is causing all these things that are manifesting in different ways. And we never really got those solutions on the Western side. And that's why we reached out to you to try to put those pieces together to find a root cause and find a treatment that can work from the inside out and not just be touching on the surface all the time.
Right.
Exactly.
And I think the way he described it with the puzzle, we even went so far as I looked at the constructs of all of his symptoms and I tried to find common denominators. And hence how I got your son's video when I looked up the common denominators. And I think your son's testimony like resonated with me. I'm like, this is my child. Like, I could hear exactly what he was saying I was seeing with our own child. And it was just an eye-opening experience. It was so phenomenal to see the commonalities, but at the same time, when we started going and working with you, I think the thing that was most beneficial was it wasn't a one size fit all. It was very personalized. You were very clear and concise about the process. You were very tender and gentle how we were going to transition with this. It wasn't like, here's all this stuff, take it and good luck and see you in 6 months, because they literally, in Western medicine, we came home with a lot of bottles and a lot of pills. Yeah. They never discussed the process, what the procedures were, what we needed to do. And we were just left on our own.
It's kind of like a fend for yourself. Whereas, we like the approach today where we can have the discussion about why we're doing something, what it's supposed to do, what it'll look like, and what the end result is. Before, it was kind of like, here it all is, have fun with it, for lack of a better description. So
yes, for 6 months and see you later. So as not to trash modern medicine, because I often do, but I know it is great for acute issues, life-threatening issues, emergencies. But yes, I do think that for children with chronic problems, suppression medicine doesn't seem to be an answer if we want to see our kids not just surviving but thriving. That is right. And you mentioned my son Brian, right? I think one of these days, do you guys recall that show, Everybody Loves Raymond?
Yes.
Right. So there's going to be
his wife. They say I look like his wife.
Yes. Yeah. Yeah. Patricia, someone, right? But I think, someone once mentioned to me, I have another mom who is a TV producer from New York. And she said, we should do a show that everybody loves Brian. Yeah. Maybe, that might be a good idea. I actually remember the episode in which, Raymond's brother, Robert, rolls his eyes and he goes, everybody loves Raymond. Yeah. So, but yes, I'm really glad that Brian has been able to do those interviews and lectures that he did and able to share and articulate. And, as you guys probably know, he's on his way to becoming an immunologist. And that's what he wants to do, spread the word out there further so that in pediatrician offices, specific customized medicine becomes the norm. So that's something. If I may, you mentioned that we did a lot of testing, and then all of Cadence herbal protocol was fully customized and tailored. We did the genetics, we did. So can you speak a little bit more about that? What did the testing show? Do you recall?
Well, the testing went through, obviously we went through the process of doing the different tests locally.
Yeah.
And the tests basically would show that he had co-infections at different levels that wouldn't really show up on the Western test or wouldn't really be recognized. They would look at them and go, oh, they're perfectly fine, they're in the normal range. But working with someone like yourself who's more experienced, you've seen the trigger points or the markers listed in there from your experience that kind of shows what he may or may not be dealing with. And that was the big plus to all those tests we ran, was to try to come up with a framework of where we were at to come up with a framework of the treatment plan. So.
And I think what the test revealed to us is exactly what we were seeing in him. Every time we would go to his doctors, and we went to many of them, we would try to explain that he was like in a cocoon. It was like he was resorting into a cocoon, and they would just address like one tip of a test instead of like getting multiple avenues of testing to determine exactly what is existing within his body that's making him unhealthy and making him experience pain. And with all of your testing, we got a full picture of exactly what he was experiencing. And I can remember when we went to a renowned hospital in the Midwest, the doctor looked at us and she said, how is he standing with all of this inflammation in his brain? But after she said that, there was like no discussion on how we're going to deal with that.
Right.
Whereas when you came back with all the results, I felt compassion and empathy that you wanted him to regain his health, and that there was going to be a process and there was going to be a foundation. And based on the evidence of the data of the testing, you were customizing that to support him in regaining his health. And that's the part that the testing, like, it opened our eyes, like, this is exactly what we're seeing. And now we're actually treating what he's experiencing and not what is at the surface and, you know, is known in the research and in scientifically based books that have been for centuries that they've seen in other human beings. Because I'm not saying he doesn't have what they have, but it's very different at a different level and based on his age and his weight and his immune system. And that's what you gave us, is that picture, that all around picture that was very holistic and eye-opening for us to see.
So you were able to connect the dots based on the testing, and that's really important as a parent versus, you know, just going in and trying to suppress the symptoms and moving forward, you know, just so that he can quote unquote behave himself in class and get an education. Versus really digging deep and looking at the root causes of what was causing those symptoms. Because, you know, if you don't look at root causes, what I found on my journey was that some of the root causes were not looked at in the beginning, because for me, it was a 7.5 to 8 year journey of little by little discovery, self-education, and finally putting everything together, amalgamating all this information that I gathered. So when I approach a new patient, all of those years of experience and research just comes to that first appointment. And you know, an individualized algorithm starts to form in my mind that, you know, this child, this is probably what's going on, and this will probably be the trajectory of recovery, which further is, it gets further refined once we get the individualized testing back. So the soft signs which were seen, right? So yes, it is quite common knowledge now that testing for tick-borne infections can be quite controversial, can be difficult to see. And the reason for that is trying and understanding the workings of a very complicated human immune system. It's an amazing machinery which works along. In fact, it is a crucial component of the body's innate intelligence mechanisms. And understanding that many of these underlying infections and underlying toxins will suppress either the adaptive or the innate part of the immune system, it slowly makes sense as you try and unravel the facts that if the immune system is suppressed, who is going to show you the titers in the labs? You know, of course, they are going to be a little bit off track because there is immune dysfunction going on. So that is something that is difficult for many parents as well as practitioners to grasp or wrap their heads around, is immune function. So so I'm glad you actually brought up the soft sign, because it is important to understand that it's not always black and white, and to be able to interpret the grays in between that. You know, this is leaning towards Bartonella. And again, it's very important to not go in blindly, but to kind of connect the dots with clinical symptoms. And Cyndi, that's
Mhm.
what you mentioned, that you were finally able to connect the dots with clinical symptoms. So how did you guys, the herbal protocol, herbal medicine, as you know, is not just hundreds, but thousands of years old. There is plenty of evidence-based. I think in my recent book, I have about 40 to 50 pages just about the herbs and the BioNexus protocol that is relating only to biotoxin illness, and then herbal greats like Stephen Buhner, Julie McIntyre, they talk about tick-borne infections, and they have thoroughly evidence-based information out there available on the use of natural medicine, right? So how did you manage with a holistic organic diet? How did you manage with herbals and supplements? How did your son manage?
It's so I will say this, coming from a Hispanic background in northern New Mexico, herbs and remedies are very prevalent. And oftentimes people look at it very different. So I did grow up with herbs and remedies. I think the hardest thing for us as parents is when we started the process to develop a foundational element of healthy eating was the hardest part for us. And the reason is that society offers a variety of foods out there that are very tasty and appealing. And when you start looking at the diet and preparing for entering, using your herbals and all of that, we sort of have to take away all of the unhealthy things that are in the system. And it's like peeling an onion. You can't just do it all at once. You have to, because your eyes start to water. We have to take one thing away. And I think part of our journey was explanation, part of our journey was education, and part of our journey was asking, do you feel better as we remove this from you? Are you feeling better as we transition into a healthier diet? Now we're transitioning into herbs. So we have and I think we shared this with you, our notebook, where we have everything listed from what he eats to temperature to herbal remedies, so that our number one goal is to check with him, because he's our resource to tell us if it feels good, is it working? And when he does not want to follow something healthy because he is a tween, we'll ask him, how do you feel? And he's like, not so good. I ate gluten. You know what I'm saying?
Yeah.
So it's that checks and balances, that not only what we're learning from you, but what we learn from ourselves. But he knows now that his body can only handle what is organic, healthy, gluten-free, things of that nature. And he knows when we give him the herbs, it's really helping. The number one thing that he used to complain about was pain. That was the number one thing.
Yeah.
And his pain level, we had a pain scale 0 to 10, and he would tell us it was always 10, 10, and now it's like 0.
So pretty much 0, 1, maybe on a rough day. But as she mentioned, just the process of working through it, he realizes what now is a trigger and what's a consequence for the certain dietary choices. So those things don't happen overnight. You've got to build and go through the process and get the buy-in, and that happens over time. And that's what we did to get the diet side of things on track.
And before we had talked to him because my family up north knew he had been sick and wanted us to go to a curandero, where they crack the egg and they try to fill out the illness. And he was open. Like, everything we do, we ask him, we get permission. We want to make sure that he understands that this is a lifestyle. This is something that will make you healthier when you're older and continue on the path of regaining your health. This is not, one shot deal. And, it's not, I'm giving you a shot and you're going to feel better and everything's fine. So it's asking him permission of what he wants, you know, to be part of. And he recognizes that he doesn't want to have pain. He wants to be pain-free. The herbal remedies that you use, they have no taste. He doesn't feel like anything is of ill in taste, like in the other stuff we used to give him. He was taking items that I couldn't even smell. You know, it was, so I think has been our journey. And we talk to him, we educate ourselves, we truly have seen a growth. And like I said, he's coming out of the cocoon. I see a little butterfly, a metamorphosis change. And it's so phenomenal just to watch him compared to the last 5 and 6 years. I mean, the doctors, when he was deathly ill, he didn't have any behavior issues. He just couldn't stay awake, and they said, send him to school, and he would be sleeping at school. And we were like, well, this doesn't make sense. Like, you know, he's asleep. Why are we sending him? He's not getting better. And they would let him sleep in the corner.
Oh, goodness.
Yeah. So, yeah.
So it's been a 5 to 6 year struggle and challenge for all of you. You know, Caden sounds like he is. I know him by now. He is intuitive, old soul.
Yes.
Right. You know, very, very holistic, like both of you. I can't even say takes after his mom, because both of you are very natural minded. Can you take me through his journey when he first fell sick, when you discovered all of the co-infections, the comorbid issues? What were the symptoms that you saw? What were his challenges? And how soon after starting the herbal protocol did you start seeing improvements? What those were and where he's now? If you wouldn't mind taking me through that.
If we go back to the beginning on it, he had a stint when he was, 5, 6-ish, when he was very ill in the hospital, high fever, respiratory issues, just inflamed. Never could really get to the root of the issue there. We just were basically treating symptoms, some medications, but nothing really to solve it. He ended up leaving the hospital. And from that point forward, you could just tell that he was having some involuntary body movements, that he just wasn't feeling good on the inside. And he slowly, as Cyndi mentioned, the cocoon, as time went by, he slowly kind of was open, kind of was a closing up as he went by. So over the years, we just attempted different avenues from, as we mentioned, other clinics, things like that. And it just wasn't working. So.
And then I think when we met you, the process, we shared exactly what his symptoms were that we saw on the outside. And then we shared with you what he shared with us emotionally. So not just the physical components of what he was experiencing, but the emotional. And so when we said to him, are you willing to try a different path of herbal remedies? And we talked about what medical medicine was in herbal remedies and what sort of, he's a tween. So we also were having those discussions of drugs and alcohol and, as part of his health. And the thing he asked is it, will this make me feel better on the inside? So it wasn't so much how he looked on the outside. He was very confident, even though he was shaking, had the tics and, certain limitations. He wasn't so concerned about the outside. He was very concerned about how he felt on the inside. And we said, we're going to track as we start entering into this phase of herbal remedy. We're going to track with you every single day how you're feeling so that you can tell us how you're feeling on the inside, not the outside, because you're very clear you want to feel better. And I don't want to say like, I'm not saying like it was like he drank from the fountain of youth and was like, woo, right. But it really felt like in a short period of time of 3 to 5 days that his pain was subsiding a little bit less, and we would ask them, what is feeling different? How are you feeling? We started to notice, from a week to a month, his tics were subsiding, his head shaking, and you could slowly see the progress. And while it seemed like forever, when we go back and we look at the charts and our data, because we kept days and stuff, it really was a process that happened daily. As we, added something. And I think the thing for us, it was that he told us he felt good. And not only did he feel good on the inside, but we started to recognize on the outside, he was starting to look a lot better, like his facial features. One of the key indicators that I realized he had pain is he would rock in a car. And one day it dawned on me when I went back and I looked at the data before we started working with you. I said, what's your pain level? And he said 10. And I thought, okay, so I did that in my head. Then a few days later, I noticed in the car, he would like try to control himself. I said, what's your pain level? He said 10. And I said to Kerry, when he rocks, he's trying to control the pain.
Right.
And it's interesting because we haven't seen that.
No, and I don't think we fully realized the level of pain he was trying to control, or just the internal discomfort for all that period of time. But then, as Cyndi mentioned, once we started on some of the new treatments, you could tell pretty quickly that things were starting to kind of calm down a little bit, for lack of a better description, inside, and it kind of allowed him to start to move forward. So,
yeah. And he felt more confident, like his self-esteem. He's a very confident kid, like very confident in his words. He's very clear about what he wants. He doesn't have a lot of gray. He's sort of a black and white kind of kid.
yeah.
But what we noticed where his confidence was diminishing is in physical activity, because he was extremely physical, and gymnastics, diving, golf, running, biking, everything that he likes. He was doing Wiseful on unicycles, they're like trapeze and things. And even though he was experiencing all of these symptoms and all this pain, he would still attempt to do it. And we could see the frustration, but he wasn't going to let it get the best of him. And then when it started becoming higher in pain, it started getting the best of him. And I guess for a better sense, I kept saying, am I a bad parent? Because I'm not fighting for more answers, even though I fought for a lot of answers. And I think the herbals have just been phenomenal. They're non-invasive. He knows he can't OD. I mean, the first thing he says, well, could I OD on these? Can you give me too much? Because, when they're in middle school, they talk about drugs and ODing and, not to take prescription painkillers. And, that's a big thing now in middle school. And we're like, no, we follow the process. We have it listed. So he sees the numbers. At some point we want to empower him to start being more responsible too,
Yeah.
I know the bad parent comment is kind of funny, because you're always, as an advocate for your child, you're constantly like trying to find, there's got to be something to look for. And as you keep going through that process, people keep looking at you like, we look at each other, are we crazy? Thinking that there's something more going on. But you just keep plodding forward, and eventually you find the right mix of people to work with, as we have now. So
yes.
I mean, once you find your own tribe, as they say, right? Crazier and weirder, the better.
Well, no, but it's the energy. You can feel like the energy is so positive, and there's not like this negative cloud hanging over you, because you feel a sense of success every single day. Watching him grow to the kid he can be and regaining his health. Like you can see him standing straighter, walking straighter. I mean, and he's not a kid that complains. I think we mentioned to you in in our initial meeting when he broke his foot and he, broke his clavicle. He's like, fine, I'm fine. Just put Aquifer on it. Like Aquifer was like a miracle drug or something. I'm like, Aquifer. But you see him now standing, stronger and happier, and going through the middle, the teenagers. Yeah, middle school.
With it at the same time.
Yeah.
That is so heartwarming to hear that, so no pain, no motor tics, his gut is fine, his sleep is fine. Academically, he's doing well. He's back to doing sports as well.
Mm-hmm.
Mm-hmm.
And I think, he's starting to get back academically. I think it's been a little slower just because of COVID.
Right.
I think, trying to re-navigate a situation that was unexpected. So he and I talk often. Where do you see yourself academically? What are your strengths? I do surveys with him. When I was an educator or teacher, I always would check in with the kids. Where do you feel you need more help? Where do you feel you need to grow? Where you're growing the best in and you want to take, a step back and say, that's something I don't want to focus on. What is something you want to study that we haven't? And I think it's been a slow process because of COVID. We're going to school, we're not going to school, we're homeschooling, until we decided as parents that we were going to set a solid foundation, and we're like, okay, we're going to homeschool you and we're going to send you to an outdoor school one day out of the week for socialization, so that there was too much of a mixed bag of messages with education in the school system with COVID. So he is starting to feel a lot more better, I guess,
just
confident
in his education.
Because he was he learned to read at 2, and we did not teach him to read. We were like, oh. So yes,
so many similarities with Brian. Same thing, he started to read on his own at 2, and I'm like, I didn't teach him this. What happened? He keeps back the code, so to speak.
Yeah. So yes,
amazing. I think the two of you are professionals. You did a lot of research. I think you're both, I don't know, amazing parents, and I really appreciate you doing this. You're welcome. I really appreciate you doing this today. I know it's going to give hope to hope and options to a lot of families looking to go with non-invasive treatment options for their children. Because your story is similar to mine, where we tried a lot of invasive options, just because back in the day for Lyme disease, PANDAS, type of issues, the most aggressive treatment was considered to be an invasive option, one after another. We didn't really see any lasting progress until we switched to a completely plant-based protocol, because it was intracellular. It started, like you mentioned, peeling an onion. It started to go in deeper and deeper into his cells in his body, and then started to clean him out.
Yes.
Can you summarize for me? Can you tell me in a few lines before herbal protocol and after herbal protocol?
I'd say before the herbal protocol, we were going through the process of determining where he's at, and there was not a lot of light at the end of the tunnel. But since we started the new herbal protocol, you can see it. There is an end game to his challenges, and each day as we move forward, the light gets a little brighter. And I'd say that's what's happened mainly with the herbal protocol, is we see the end game and the light is brighter at the end of the journey.
And I would concur with him. And I would also say, prior to the herbal protocol, they wanted to fix him. It was like a quick fix and then move on to their next patient. And what we've discussed or discovered with the herbal protocol is that it's a process, and it's regaining health and feeling good, and not fixing something that's on the surface, but feeling emotionally, physically well all around, so that you can see him continuing to shine in whatever path he wants to live and not be hindered by, you know, the pain or that it was only temporarily. And I think that's what I like. And I see my child who was in a cocoon is now becoming a butterfly. And I use that all the time when I see him. I watched him in the bed in a sort of fetal. And then as we started using the remedies, I watch him sleeping differently. He's sleeping stronger, and then he's walking stronger. And I see him flying high and shining bright. And that's what I'm most thankful for, is that it's working the whole body and not just a symptom, which is a quick fix. And then it's, then we're on to somebody else. And I want to thank you for that, because it has really enlightened me. And I share your name often because I think we as human beings have issues of medical issues that are not addressed, and we just settle. And I think people need to explore what the earth offers us, and how we can better ourselves and feel holistically healthy inside and out.
That was so eloquent from both of you, and very well put, very poignant. You make some very important, pertinent points. That returning back to earth, I think that was one of the messages, the hidden blessings that came to the surface with this whole pandemic, that it made us realize, what is it exactly that we really need? Why is Mother Nature so angry? It's so
yes,
right?
I've said it many times. Mother Nature is sitting at her desk and she's not happy. She's trying to figure out the next thing to do.
Oh boy.
Yes.
Yeah. Not to make light of it, but
No.
it's just, it is, you have to find humor sometimes to deal with extreme challenges. So that's,
And you have to be, one of the things we have to be is part of the solution. So, we can't continue to do what we do just because it's a convenience when we don't think about the lasting effects. And I think that's what I love about your program, is that you work with nature and you work with plants, and it's not about, okay, here's a drug that's going to do something or another and alter something or another, and hopefully you'll feel better. So I think that's the thing.
No, I agree.
That we like. So as my son says, it's not a drug. I'm not going to OD,
Yeah, I know, that's so funny. That's the first time I've heard about that. Yes. So it's herbal medicine, Mom. So, I'm not going to OD on it, right? Is there any OD potential? So no one's ever asked me about any OD potential on the herbal. That is so cute. It's been fantastic to see the two of you again. Thank you for taking the time out for sharing your story.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.